Good evening, friends. We are glad you're joining us either here on Zoom or on Facebook Live or on Facebook Live later or watching a recording whenever you are. But welcome to tonight's edition of Perspectives at the Mission Cincinnati. We are excited to have sharing with us tonight Dr. Tricia Eshleman Latimer, who is our resident psychiatric resident physician. Like to think of her as our resident at the Mission Cincinnati. So she will be here sharing with us tonight on a Christian perspective on depression. So we're really eager to hear her sharing from her perspective as a person of faith and also as someone who professionally has a really well-grounded perspective to offer us as a physician. So we are going to hear from Tricia, and then we'll have some time afterward for some discussion together. So I'll hand it off to you right now, Tricia.
All right, can you hear me okay? Great. All right, thank you, Emily. I'm really happy to be here. I'm so grateful to be able to talk about this because I think depression is something that affects a lot of different people in different ways too, and can really look like a lot of different things. So I wanted to just start off with a quote, and it's by J.K. Rowling, who describes depression as that very deadened feeling, which is so very different from feeling sad. Sad hurts, but it's a healthy feeling. It is a necessary thing to feel. Depression is very different. And I want to start off by saying that sadness is important. It's a healthy, normal emotion. And oftentimes when we feel sad, we might say that we feel very depressed. But when we think about actual like clinical or even subclinical depression, it's so much more than that. And that's part of the reason that depression interests me so much. It's more than just a feeling. Of course, it affects you psychologically, but it also affects you biologically. And I also think that it can affect you spiritually as well, especially since our mind, bodies, and spirits are so intertwined. When our physical health goes downhill, oftentimes our emotional health can take a toll. And then at those times, we often seek God more, or we might feel that God is further away from us. And I often think too that depression is very insidious. It's a sneaky disease, I think, because sometimes people feel sad, but oftentimes too, they feel more numb or dead, or they just lose pleasure in things. We refer to that as anhedonia, or just not really enjoying things anymore, or not feeling anything at all. And it affects a lot of other aspects of a person too. So they might paint the world in an entirely different way, or they might see everything as somewhat downcast, and kind of view the world in perhaps a more negative light. Some people might feel irritable, some people feel tearful, some people might feel very guilty about a myriad of things. And we have multiple subtypes of depression as well. It's super common. I think 7% of adults have had a depressive episode in the US, and that is those who've been diagnosed. There may be other people who experience subclinical depression, or were misdiagnosed with something else as well. And it's so much more too than just like a lack of serotonin, which is so often referred to as like the happy neurotransmitter, or it's been like dubbed that, because that's what a lot of our antidepressants work on. But the truth is that the response rate to those antidepressants, at least the first line ones, is only about 40 to 60%. And true remission only occurs in 30 to 40% of these individuals. And then they go to second line agents, or they might try other means to try to treat their depression. So clearly there's so much more to the picture than just one neurotransmitter, or even like psychologically one thought pattern, or and it's more than just like, oh, praying it away or things like that. It's a big picture sort of disease that it really touches a lot of different aspects of a person. And there are a lot of different theories regarding depression, and I'll kind of go through briefly some of the interesting ones that I found. There's biological theories, there's cognitive behavioral theories, psychodynamic theories, and then like stress diathesis model, which is like you have a stressor or a significant stressor, and chronic stress over time can also lead to depression or depressive like symptoms. And then we also know that people are predisposed to depression. If you have a family member who has depression, you're more likely to have one as well. But it doesn't mean that you will have one. And I also just want to say that depression can often look a lot like grief as well. When grief hits, people often feel very sad, understandably. They might feel irritable. They might have changes in their sleep or changes in their appetite as well. But these are temporary. And arguably too, grief is healthy, a healthy response to a significant loss. And so sometimes from a psychodynamic perspective, depression has been described as a deep sense of loss. So in order to kind of fully understand, I think, the spiritual aspects of depression, I wanted to kind of go through the biosocial, psycho-spiritual model of it. So as far as like the biological aspects of depression, we don't know exactly what causes depression biologically. We know that biology can impact whether or not a person develops depression, but also depression impacts people biologically too. So different areas of your brain involved are things like the limbic system, where your emotions occur in your brain. And then that connects to like your higher order thinking. And then also, which also connects to, so your emotion centers in your brain are also connected to your midbrain and lower centers, which control things like sleep, appetite, and other kind of basic functions. So that helps it kind of understand that like when we have a significant emotional stressor, it impacts not only our thoughts, but it can also impact our sleep, appetite, and just everyday things like being able to get up out of bed and having the energy to exercise or play with your kids or with your dog. And we know that a lot of neurotransmitters are involved, more than just like serotonin. There's dopamine involved and norepinephrine. And previously we thought that we just thought these neurotransmitters are low. And that's part of the picture. But arguably, it's that they're more dysregulated, that certain areas of the brain have too much of a certain neurotransmitter or too little of another. But we also know too that although antidepressants don't always work, they can be very healthy for the brain too. They can help increase something called BDNF, which is a substance in your brain that actually helps your neurons stay healthy and can help form new synapses, so that when you start having new thought patterns, when you start engaging in therapy, it's a little bit easier because you're able to make those neurons, able to make those pathways a little bit easier. You have more plasticity in your brain, you're more flexible. And I think that can really help some people. And then we also know that nutrition is really important too. They've shown that people who don't eat enough of something called tryptophan, which is an amino acid that plays a part in protein structures, tryptophan makes the neurotransmitters. So we make neurotransmitters from tryptophan. People who have tryptophan completely depleted from the diets, stop responding from antidepressants. So we know that like getting enough food and getting a variety of food is really important in feeding your brain. And one study even found that, and this is a more recent study, that people who engage and eat in a Mediterranean diet are less likely to develop depression. So it is important to eat enough food and then to eat plenty and a variety of food. As far as psychological aspects of depression, I think the many therapies that we see are things like psychodynamic therapy. We also have cognitive behavioral therapy, and then all of the sort of subcategories of cognitive behavioral therapy. And I think so there's a few different viewpoints in psychodynamic therapy regarding depression. So we've talked about the possible like deep loss experienced, but also one author who's Nancy McWilliams, she's a really great author, who described two basic types of depressive personalities, or those who are more likely, personalities more likely to develop depression. There's the introjective, which is the feeling that I'm not good enough, that there's something internally wrong with me, versus anaclitic, which is I'm in need of a connection. And these are more people who are searching outward for things to cure their depression. They see that everything around them is wrong, and this is everything in the world is wrong and affecting and hurting me. And then there's also kind of the theory that it's anger turned inwards. So there is this observation by psychodynamic therapists that patients who deal with depression don't kind of exert their aggression properly, and that they actually turn it inward and towards themselves, and resulting in excess guilt. But it is kind of flawed, considering that some people who are depressed are actually can be actually irritable instead. And then cognitive behavioral therapy is one where we take cognitive distortions like I'm not good enough or I'm a failure, and we point out and we begin to recognize where those cognitive distortions are, like overgeneralization or catastrophizing, like, oh, I didn't do well in this presentation, and so I'm a failure, leading to depressed feelings or behaviors like, so nobody likes me because I'm a failure, so I'm not going to go out, and then that can lead to more depression. And cognitive behavioral therapy kind of helps point out where in that cycle they can break. So kind of recognizing those thoughts and starting to change those thoughts, seeing where they lead to those depressed feelings, and then thus the depressed sort of behaviors, or the behaviors that can lead to further depression. And then finally, I wanted to kind of touch on the spiritual aspects of depression too. I think sometimes we can kind of overemphasize the spirituality of it, but we can also underemphasize it. Because I think too that when somebody's depressed, whether it be from biological reasons or from more psychological roots, I think it can impact how we feel about God, how we feel about ourselves, and maybe even how like it may make it harder to see God's love or see where God's working in your life. So I found this really great article. It was actually from, I think, the Taiwanese Journal of Psychiatry. And it was regarding, it was just called Dealing with Depression, A Christian Perspective. And I was surprised that it came from the Taiwanese Journal of Psychiatry, but also really fascinated by it. So they kind of touched on several points, but I really like this quote by the author. He says, "In the depth of depression, you lose interest in everything around you, including your family. The joy once you enjoyed for granted has all but disappeared. You feel no sense of God's presence or that he is hearing your cries for help. You also feel that God keeps silent in spite of your desperate praying and crying, and that as if being fallen into a deepest dark pit. So often, sometimes in depression, we might feel very far from God, but also I want to say that too, there are different experiences. Some people may also feel very close to God. I think that quote kind of reminds me of David when he writes some of his Psalms, like walking through the valley of the shadow of death, but yet he feels God very close to him. So I'm just going to kind of touch on 4 aspects of spirituality that was mentioned in this article. So there's the perceived connection with God, feeling very close or maybe perhaps very far from God. There's guilt, positive optimism / pessimism, and then community. So I think we kind of touched on the connectedness to God, so I won't kind of dwell more on that, but I do want to kind of touch on faith itself. I think when we think about faith, I think sometimes people can have this false perception of faith that it leads to this sort of distorting rosy glow that everything's great and like everything will turn out wonderfully. But really, it doesn't even focus on our problems. It kind of keeps a very balanced perspective of the world, and often that perspective, that balanced perspective of the world, that yes, the earth is bad right now, things are terrible, we're global warming's happening, we're in a pandemic, all of that's happening, but at the same time, God is renewing the world. And so that leads to kind of a dialectical sort of thought process that, like, even though the world is bad and everything is just like, it feels awful, I know that God is still renewing the world. God's kingdom is still here and now and to come and will be. So it's a hard perspective to kind of get, because we often think in sort of black and white, or it's easy to think in black and white, that things are either all good or all bad, or all good or all bad. But really, it's a paradox. Things are bad, but things are also really, really good. And then also I wanted to touch on guilt. So often in the church too, it's important to have guilt because it keeps us from doing awful things. So if I hurt another person, like I punched my brother or something, if I didn't feel guilty about that, it makes it much more likely that I'll do it again, because I don't feel a bad thing. In fact, maybe I think, well, that's good, I punished him, maybe he'll leave me alone. But if I'm able to empathize and think, well, if that really hurt him, it can be a good thing. But oftentimes in depression, I notice that there's an excess of guilt, and that people think, like, I'm awful, I did this to a person, but and they often throw the self-compassion piece to the wayside. And as Christians ourselves, we don't want to be debilitated by guilt, but I also don't want to be completely complacent either. And so I think too, this leads to another sort of dialectical thought that, yeah, maybe I did do something terribly wrong, but also, like, God loves me and God forgives me, and I'm going to have compassion on myself. And really in psychology, we've kind of moved away from sort of the self-esteem model that, like, you just need more self-esteem, to more of a self-compassion model where you're like, well, I'm like average. I'm not really great. I don't suck, but I'm still going to love myself, and I'm still going to have compassion on myself and forgive myself because God's already forgiven me. And then I also wanted to kind of touch on optimism and pessimism. And that's really, we need a balance. I think kind of going back to the psychological perspectives of depression, we've often described depression as sort of like this depressive realism, where people who have depression often see the world in a very real way. and often estimate things a little bit more accurately than people who don't. But I think as Christians, we need kind of a balance. We can't kind of like be over positive with our estimates, but at the same time, we can't dwell on the woes and hardships of the world and kind of focus on that. If we focus on kind of how difficult the world is, we lose that hope. And so, yeah, I think finally too, I wanted to touch on community. So often, sometimes, at least for some people, they can tend to isolate themselves when they're depressed or really feeling blue because you feel bad about yourself, or you feel like people don't like you very much, or you feel really guilty about things, and you think, well, people don't want to be around me anyway, so I'm just going to hide. But that is really the opposite of what we need to do. And I think too, like when we have a church member who we start recognizing the signs and symptoms of depression in, we start noticing like, hey, they're not coming to these events anymore, or they are, they just don't look well, or they're just not themselves. It may be time that we reach out to them. And I think so often in depression, we have this sort of gray painting of the world. And being in community can sometimes help us to shift our perspective a little bit. Because without community, we're kind of stuck in our own perspective, which isn't always accurate. I think none of us have it completely right. None of us can perceive the world completely correctly. I think most of us are grounded in reality. We don't have like delusions of the world, but I also don't think that we often see the world as accurately as we could, because we magnify certain problems and we minusculize or minimize other problems. And so when we're in community, it can help us to pull back the lens or put on a different pair of glasses and see, well, maybe the world isn't that bad. And sometimes too, even just being around other people can really help kind of boost those feel-good hormones. In psychology and spirituality, we talked about how just the act of hugging people, which unfortunately in a pandemic we can't do right now, but even just the act of hugging another human being can really, it boosts your oxytocin, it boosts those feel-good hormones that can even make you feel good in just a moment. It's not a cure-all, but it can help kind of, I think, kind of well-round the treatment of depression when we start kind of treating we treat the biological aspects, we treat the psychological aspects. We sometimes emphasize the biology a little bit too much, I think, in psychiatry sometimes. And then in the psychology gets emphasized a lot, like change your thinking, change your habits. But also we need to recognize that people who are going through depression, like it feels very real, and it feels sometimes it can feel very spiritual, and kind of coming alongside them as a community and helping them to feel better spiritually as well, and not just physically and psychologically, recognizing that all of those things, the social aspects, the psychological aspects, the biological aspects, and the spiritual aspects are all intertwined very beautifully. It's not separate, distinct areas that we can cure. Sure, when you have a broken leg, that's usually pretty physical, but I think what makes depression so interesting is that it touches each area, because it's syndromic. It's very I don't know, it's kind of like a blanket and kind of touches everything, unfortunately. So I think I've touched on most of what I wanted to talk about and I came up with some questions, but also I wanted to know if there were any questions or if maybe people on Facebook had comments or things they wanted to ask. So.
Yes, thank you so much, Tricia.
Yeah.
Yes, and as you said, if you are watching along with us live on Facebook, if you're watching this like tomorrow, we're not going to see your question. But if you are watching right now on the Mission Cincinnati page and you comment on Facebook, we will do our best to find that and ask the question here. But before I lead us to the questions that Tricia sent in to guide our discussion, I'm just curious to know if there are any burning questions or just comments, things that have stuck with you that you're thinking about that you want to get us started with, either Kristen or Samuel or someone out there on Facebook.
Maybe just because it's the last thing that Tricia was talking about, but the importance of community and the importance of reaching out. So just when we think about something like depression, I think we can feel overwhelmed. But as a church, we can just be attentive to our people. And so if they start withdrawing or start showing some of these things that Tricia was talking about, that we can be aware and we can reach out. And sometimes I think we can just get so tied up with everything else that needs to do that we actually overlook people. And I think such a huge part of what we're about at the church, right, is to care for each other. So it seems like a very simple thing, but really, really important, the community aspect and how big of a difference that can be. And I can say too, personally, that when I have felt sad in the past, when I went through grief a few years ago, my MO is definitely to withdraw. And that can cause a cycle, because then I withdraw, and if people don't reach out, then I feel worse. And so, community, so important.
Thanks, Kristen. And you have already hit on one of the questions that Tricia sent us to talk about. So I will pose it so we can keep talking about it. And that is, how can we as a church community help folks in our midst who are struggling with a depressive episode? And you raise a great point, Kristen, and noticing and reaching out. And I think in thinking about that, for me, there's a reminder that it's important to be in community and in relationships consistently, even when we're doing well. One, because that's what God created us for. And so that will, I think, contribute to our thriving. But then it's only when we have that community and they know who we are and they know how we normally behave and they know when we usually show up, that if something is different, then somebody can actually have an opportunity to notice. And so that just for me is a reminder, not just of the importance of community, when I'm struggling or when someone else is struggling, but to have that consistently as part of life, so that it's actually, a safety net in times when we need it. So there's my 2 cents, but open it back up.
I wanted to highlight something that Tricia said that I think is so important. So she mentioned briefly about the switch in the field from self-esteem to self-compassion. And I think that this topic is so relevant for the way that the models are shifting in psychology that's relevant for the church, a self-compassion model. And just to touch on a little bit more of that. So for self-esteem, which self-esteem does have benefits, it's just basically the way that you view yourself. So if you view yourself as good, you view yourself as better, you might feel better. But they were looking at it and saying that still involves the comparison of me with somebody else. And so I might feel that I'm on top of the world, and therefore I might have great self-esteem, but I also might still struggle in different ways. And so they shifted a little bit more to this model of self-compassion, which I do liken to more of grace or something like that, because you don't have to be the best person in the world, or you don't have to view yourself as an amazing person to have the self-compassion, it's to treat yourself with loving kindness that, and really to treat yourself with grace and with compassion when you're going through those circumstances and those thoughts. And so it just is, I think, very relevant and very much in line with the direction of the church and the direction of Jesus, that we're starting to shift in that direction. So I'm excited about that.
Yeah, and I think that fits in, Samuel, with just the idea of how we understand ourselves. What is our identity? Our identity as Christians is in Christ. So we know that we are made in the image of God and we're beloved, adopted sons and daughters, but we know we're broken. So I've often talked about it. We're broken and beautiful. So to hold those two things together, that's the self-compassion you're talking about. And I think that's really important, that we have this correct narrative about ourselves, which holds those two things together, because we're never going to be fully beautiful this side of heaven. We're going to have broken pieces, and it doesn't help to compare ourselves with others, just to recognize where we're at and where God's calling us and that he's got us. Yeah.
That's really good. I love that shift, self-esteem to self-compassion. You're right. That feels more like Jesus. And I guess a question that I have off of that for you, Tricia, and Samuel, feel free to jump in on this too. This is your area as well. How would you encourage someone to grow in self-compassion? If that's something that, somebody has a hard time with, when they're just hard on themselves and they think that they should, get it right or should be in a different spot or be doing things better. Like how do you build that? How do you grow self-compassion?
Yeah, I think, at least for me, what was really helpful was kind of thinking that, would I have these same thoughts for my friend? Or like, would I say the same thing to my best friend? Like, if my best friend failed a test or like messed up big time, would I say, oh, you're a failure, nobody likes you? No. And I wouldn't even be tempted to do that, because I want to be tempted to say, no, it's okay. You're okay. This is just a blimp. This is like, it's okay. And oftentimes too, when we're really close to somebody, we see them more realistically anyway. So I just think, like, would I say the same thing to my best friend or my husband or even my child, if I had a child, or my dog. So yeah, I think that's been the most helpful for me. And then also just learning to think like, it's okay. Like, if I fail the test, yeah, I failed. I'm not going to pretend like, oh, this is not true, I'm never going to fail again. No, I failed, but it's okay. I'm still loved by God. It does not determine like my worth, my whether or not other people love me. And that's what really matters.
That's really great, Tricia. I'm thinking of two things. One is, what Jesus says is the greatest commandment, to, love, love your neighbor as you love yourself. And there's kind of this like implication there that we love ourselves. And I think often, I think people of faith can struggle with that even more. Well, I don't want to make a comparison, but can really struggle with that in the name of self-sacrifice or in the name of emptying myself for the sake of others. But that's great. And then the second thing I'm thinking about is, again, the importance of community in shaping the way that we even show ourselves compassion. Like for me, when I think about, would I say that to my best friend, or would I say that to this other person. Like I have a better sense of what that's like if I'm living in healthy community and have healthy, supportive relationships, where I can practice saying that to other people, to be able to turn it in on myself. And I hear their voices too, and can maybe say, like, you know what, I'm actually going to trust that when Kristen said that really nice thing to me, that she meant it and that it's true. Yeah, so I think even in that community, I see that thread continuing through, which is really neat. That's great. Thank you. Any other Kristen? Yeah, go ahead.
Well, it's not a question. I'm just wondering out loud. I need to think about this more, but there's a priest in our province who talks about how spiritual practices change our neural pathways. And Tricia, you had been talking, you mentioned that, how neural pathways can be changed. So I'm just stating out loud that I'd love to discuss more with you, not perhaps that we have time tonight, but just to think about this whole thing about what I was talking about, our mission leaders meeting the other day, is the importance of changing our narratives about God and ourselves and engaging in practices with others. And yeah, so just thinking about this in light of depression, so what does it mean as a church if we engage in certain spiritual practices alone and together? And what if we have correct narratives about God and who we are in God? And what if we, live in community like we've already been talking about? How could that affect people who are going through grief or sadness or depression? So anyway, just the wondering of something I want to think about more of in the future.
That's good.
So I have a question for you, Tricia. Yeah, so one of the areas that you briefly touched base on, we didn't have time to go in depth, was antidepressants. And so in the church, I would say that, there's probably some tension or some controversies surrounding antidepressant use. And what do you feel are kind of the two sides or the sides of that argument, what maybe Christians would discuss in that realm? And if you will, how do we have conversations about that based on differences in thoughts, or what might be those perspectives there?
Yeah, I'm glad you brought it up, Samuel, because I think sometimes in the church there can be, and depending too on the church and the atmosphere, I think there can be sometimes a stigma or a taboo associated with antidepressants. And I think sometimes it's kind of viewing it as like you're dependent on this, or and you shouldn't be dependent on these things, that you only need to be dependent on God. But I think there are two differing viewpoints as well. And I just want to emphasize kind of the role of antidepressants too. And as we saw earlier, antidepressants alone are always people don't always respond to them. That's not to say that people shouldn't take them. I think they can be extremely helpful. And like what I said before, they can help with the neuroplasticity of your brain, help to form those new neural pathways. And they can remit depression sometimes, and can be extremely helpful. And I think kind of recognizing that they're not something that people always should be taking forever. Sometimes people need them for long periods of time, sometimes just for a few months. It depends on the person and how many depressive episodes they've had, and if they're really prone to it. And so they can be life-saving as well. So I think there are a lot of, and sometimes too, I think in the church, it can sometimes stem from what antidepressants are. They're not something that people get very, very dependent on, although sometimes people do. But they're a tool to help us. And I think a tool that needs to be used along with other tools like cognitive behavioral therapy or psychodynamic, depending on, and also using like what Kristen mentioned, like spiritual practices, because that can be very life-giving, and can help form those new neural pathways. And the antidepressants can be like a tool to help form those neural pathways. So, so maybe I answered your question, or maybe I didn't answer it, but.
I kind of a follow-up to that. I'm wondering why there's more pushback about these sorts of medicines when if it was something that had to do with a broken part of our body, like a physical ailment, we wouldn't say, oh, you shouldn't take that, or you shouldn't, go for treatment. So I'm just wondering, what do we think it is about certain Christian communities that have more of a pushback? Like physical, medicine for physical pain, whatever, great. But for this, it's not okay. I don't come from a context that's been like that, so I don't know what it's like, but I hear from quite a few people that that's kind of the context they've come from, is there's just this, no, that's not the way to go. Just trust God, as you said before, he'll take care of you. But we wouldn't say someone, again, with a broken bone, just trust God, you don't need to go to the doctor to get that mended.
Just one thought I'll add about that is that I think another misconception is that antidepressant pills are happy pills, and there is a big difference. So something like a street drug or something could make a person, they might take it to get a high or to feel happy or something like that. And yet for something like an antidepressant or a mood stabilizer or something like that, it's only intended to help correct a significant deficit. And if you're already feeling good, it's not going to have these like great effects in terms of feeling very happy or high and so forth. And there's some exceptions with maybe like certain types of stimulants, but in general, like with SSRIs, they're not happy pills. And so it's just, I think, one of the misconceptions that are out there. But
Samuel, that makes me think of another question too. Like obviously there have been people in the past who have become addicted to drugs for actually, like physical pain that they've had. So is there any like sort of data on people with depression getting addicted to the medicines they're taking? I mean, maybe that's the concern for certain people. I'm just curious, like.
Not really, especially with the SSRIs, because you don't really like feel the it takes like 4 to 6 weeks for it to work. And generally with drugs of addiction, they work immediately and then their effects come off, especially the more addictive it is usually the more like effect it has. And usually dopamine is involved with like drugs of abuse. There's some exceptions like ecstasy, and PCP, but for the most part, they affect dopamine, and things like SSRIs generally don't. But yeah, there are like some exceptions, like certain stimulants, but those are usually not used for depression anyway. So yeah, most of our drugs, they're not really abused. So at least, yeah, not from what I've observed or have heard of. But yeah, and I just wanted to point out too, I think sometimes there's like a certain taboo with antidepressants versus other drugs, like, taking Tylenol for pain, or like, getting treatment for like an infection. And I think a big part of that is like how much depression and other mental illnesses like touch other areas of your life. So like it affects you socially, if it affects your behaviors, and then it also like affects you physically too. And we know there's a physical component to it. And sometimes I think the physical component of like depression and anxiety too gets kind of like brushed under the rug, because the people who experience it, they experience that it is more of like an overall feeling of depression, along with the physical symptoms. Same with like anxiety, like you feel the physical symptoms, but it's called anxiety for a reason, because you feel the anxiety of it. So yeah, I think that's part of the reason why, and I think it's important to kind of recognize the entire encompassing, how encompassing depression is, and how much it touches like the physical aspects and the psychological aspects, and then also the spiritual aspects. And emphasizing one over the other, I think, kind of like doesn't completely treat depression. I think it requires a very holistic treatment, or very holistic kind of community-oriented treatment, along with biological treatments.
Yeah, thanks for saying that, Tricia. I think one of the things I've appreciated most about what you've shared tonight is just the emphasis on like the whole person, and the way that depression affects the whole person. And it's not something that we are only experiencing spiritually or only experiencing biologically, as if somehow we could separate those parts of ourselves from the others. And I wonder if that's maybe one of the reasons why some Christians can be wary of antidepressants. I wonder if it's because we have an impoverished theology of the person, that's maybe a little bit neo-Gnostic in a sense, where we're separating the physical body from a spiritual self that is somehow more important, and the only part of us that is, enduring, and we just have to like get through this physical thing for our earthly lives, and then we'll get on with it. But I think if we have a more holistic view of the self that says, yes, my spirit matters, and yes, my mind matters, and yes, my emotions matter, and those are actually rooted really deeply in my physical body, so my body matters, then we might not be as opposed to dealing with depression on each of those levels, including the physical body, by giving those neurotransmitters a little bit of a boost, and seeing the way that interplays with all of the parts of ourselves. Maybe that's my my more theological guess at what might be happening there.
Yeah, I completely agree. Sorry. I think
that was great.
Yeah, I think like I think we've kind of, as a society, even kind of like really separated the mind and the body and spirit into these like little cubby holes that isn't really helpful, because we know that they're interconnected. And it was really Plato who was like, the mind and body are separate, but I think like what you said, we've often really elevated our spiritual selves, and forgetting that our spiritual self is connected to our mind and our body, because oftentimes like our thoughts can impact us spiritually, and our physical self can impact our thoughts. And so it's all interwoven rather than in little cubby holes.
Yeah, that's good. Thanks for that reminder for all of us. Well, as we are getting closer to our hour here, I want to make sure that we hit on another one of the questions that you gave to us, Tricia, just because it's really timely. And we've actually hit on most of the other ones already just through our conversation. This is 2020. It is currently October. We are 7 months deep in a global pandemic, at least 7 months deep since it really affected us here in the US. What role has this pandemic played in either exacerbating or even causing depressive episodes for people? I'd love to hear, Tricia, your professional, opinion, I guess, on that first, and then from everybody else, just what have we seen and what have we experienced?
I think, at least from what I've kind of noticed, and I don't really have like data or I haven't looked anything up really, but just kind of like not being able to hug other people. I think like for the longest time I was just like hugging my husband, which is great and good, but it's important to be able to like visit family members, especially for like the elderly. I think of my grandparents down in Florida who were kind of a little bit isolated, well, a lot of it isolated really, because they're not able to come up, they're not able to get out of the house as much. And we know that when we isolate ourselves, it can kind of make somebody more depressed, or it can kind of even trigger some depression. And then I think also kind of in with other kind of more from a biological standpoint too, people aren't really able to make appointments for like their counselors easily, or it was really hard to initially because we're transitioning to telehealth like immediately because suddenly this pandemic hit and we're like, well, we can't meet in person, but they still need to meet, so how can we do this? And then also, if you're not very technologically savvy, it's like definitely a sudden learning curve that's being hit at you, and that can be really hard. And I knew some people who just stopped taking their meds or like stopped seeing their counselor and lost follow-up, and that can make depression worse. It can make any condition worse. So not getting the help, the professional help that you need. And then also like anxiety regarding the pandemic, fearing death, feeling like, yeah, am I exposed, can lead to depression as well. When I was kind of reading more on mood disorders, there was a theory that anxiety and depression are actually spectrums of the same thing, because we know that as our first line agents also work for anxiety too in the long run. So yeah, having some of that anxiety there, that chronic stress that you can't like really let out, like that sort of boiling under the surface there, I think can also lead to significant depression as well. So I think there's all sorts of factors at play. And then just kind of like adjusting to new life is a stressor. So yeah, and if there are any other thoughts too, I think there are a lot of different aspects that could be explored.
Just two other ones briefly, as I work in an outpatient clinic. There's lots of research on people with immunocompromising conditions. So arthritis and others have higher rates of depression. So to think about people who already can't go out because they're immunocompromising condition, and then they have depression, could exacerbate. And then the other one I've seen recently is people who lost their jobs, just lost their jobs, and who are already struggling with depression, have been having tougher times as well.
Yeah, and I just want to say we had a bit of a private conversation right before we started our Zoom call talking about the startup of in-person worship indoors for our church. And despite the fact that I am uber cautious when it comes to COVID, and as I said before, we have lots of precautions in place, so I feel actually comfortable. But one of the reasons that I'm willing to do that, because there's always going to be some small risk if we meet other people and not isolate ourselves in their house. One of the reasons I want to do that is because that I have been reading about mental health crisis coming with COVID, people feeling isolated from community, all that stuff we talked about before, like if you're depressive and you have no one around you. So for people like me who live alone, there's others in our congregation who live alone, and just for many reasons, I think it's really important that we have in-person worship in some manner. And of course, take as many precautions as we can to make sure we protect our vulnerable in our midst. But that's one of the big reasons, the spiritual, psychological health of our people. I mean, we need each other. We need the church community. And so let's do it, even if it looks very different than what we'd normally do. I think that's okay. It's because the point is not the particular music we have or style. It's about being the body of Christ together and caring for one another.
Thanks, Kristen. And I, for one, am very excited to be back to in-person worship together. And really that takes us back to where we started this conversation and talking about community and the role that that plays in caring for one another. So I'm glad that we can take one more step in living that out together as a congregation here in a week and a half. So that's exciting. We are at time. So thank you so much, Tricia, for leading our conversation tonight. Thank you for the time of study and practice that has made you into an expert to be able to share with us. And thanks for the way that you serve people through your work in psychiatry. We're grateful for you. And thank you, Kristen and Samuel, for your great addition to our conversation tonight. And thanks to anyone who stumbles across this, or even better, seeks it out on Facebook or on the Mission Cincinnati website. So next week, we will not be here because we will actually be training volunteers to return to in-person worship. So we will not be meeting for Perspectives next week on the 22nd, but the week after that, on Thursday, October 29th, if I'm counting my days correctly, Thursday night at 7:30, Reverend Kristen Yates here with us will be sharing about a theology of creation care. And Kristen has a really unique perspective to bring to us as she currently serves as a priest in the Anglican Church. But one of her many lives prior to that, she served as an environmental consultant. So she'll bring to us some really wonderful expertise at the intersection of creation care and theology. So we're looking forward to that on the 29th. So thanks again for being with us, and we'll see y'all next time.